This was 4 months, but look at my skin versus now. I thought that my life was over, and I thought it was never gonna get better.
If you're someone that deals with acne or struggles with acne, I want you to know acne is very normal and very common. I see patients all the time from actually very young adults around age 8 to 12, and then they can experience acne all the way into their teenage years and through adulthood, even up until their 40s. 85% of teenagers have acne. So, as you can see, it's so common, we see it so often, and there are ways to help you. Acne has a lot of variability to it, so it can either present as a comedone, which we also know as blackheads or whiteheads. Also, you can see them as papules, pustules, even nodules or hard cysts on your face, and also as scars. So as you can see, they can have different shapes and sizes and different forms to them. Acne is typically located on your face, on your cheek area, sometimes in the chin area. You can also see it in the nose, the foreheads, and even sometimes in the ears. Also, it's very common in the neck and on the upper trunk, which is your upper back, as well as the chest. Some people get in other places along their arms, but acne likes to go to places that have high oil content. And we're going to get into that because that is one of the causes for acne. But that's why you see them in those areas. Your face has a lot of pilosebaceous glands, and those are hair follicles mixed with oil glands. And that's why the highest concentration of acne is going to be found in this area as well as the upper back. The most common age for men and women to see acne, by the way, men and women get acne, so this video is not just for women. And actually, if men get acne, sometimes their acne can be worse than the acne women get because men typically have oilier skin. And as I said, acne likes to live in an oily environment. So typically the age is between 15 and 18. That's when you really start to see a spike in acne. So now let's talk about the main causes of acne. First up is hormones. So the primary cause for acne is a spike in your hormones. And we have hormones called androgens, which are also known as testosterone or estrogen. And what happens is during puberty, your sex hormones start to come out and increase. And they actually start to stimulate the oil glands that we have on our skin. And that causes an increase in production of oil. So it's a cascade. So first your sex hormones increase, and then that stimulates and activates your oil glands, and then you produce more sebum, which is also known as oil, and then acne likes to live in that oily environment, and you get a lot of acne. So primary cause for acne is hormones. Also, if you're someone with polycystic ovarian syndrome, also known as PCOS, typically you have an increase in androgens or your sex hormones, and that can lead to more acne. So if you're someone with PCOS, you will also be struggling likely with hormonal acne. Next up is follicular obstruction. So what in the world does that mean? So we get that increase in oil production, and that leads to an occlusion of the pore, and it leads to retained skin cells building up, accumulating and sticking together. So think about it like this. You have like an open tunnel and you're throwing in dead skin cells in there and oil, and it's all stuck together. You can't get out. And then it starts to form this blackhead, whitehead, comedone, or papule. And that's what leads to that acne and those clogged pores. Next up is bacteria buildup. We all naturally have bacteria on our skin. However, some of us have more than others. And no, this does not mean you're dirty, it doesn't mean something's wrong with you, and it does not mean you have to wash your skin vigorously. Actually, it's just that you have an environment on your skin where the bacteria thrives, and particularly a bacteria that I'm just going to abbreviate for now. It's called P. acnes. This is the most common bacteria that causes acne. And so what happens is if you're someone with oilier skin or you have increased oil production, bacteria likes to live in that environment, and you're going to break out in comedones, whiteheads, blackheads, papules, even cystic lesions, and that is going to lead to an increase in your acne. Now, another possible cause for your acne is comedogenic products. You may be using hair gels or makeup that is clogging your pores and causing whiteheads and blackheads. However, they have gotten better in the makeup world and in the cosmetic world at making products that are non comedogenic. So, you're going to want to look for a product that says non comedogenic on it to make sure that you're not flaring your acne. Believe it or not, another cause of acne can be from friction or rubbing. So, if you're someone who's aggressively washing their face or scrubbing your face with harsh either sponges or even towels to try to get rid of those blackheads, whiteheads, or what you think is dirt, I would advise you to stop doing that right now because you're actually doing the contrary and you're causing inflammation, which is leading to more acne. By the way, if you're someone who likes to wash your face in the morning, evening, at any time of day, I recommend using your hands to wash your face. So always like wash your hands first and then wash your face. I don't recommend using a washcloth because that washcloth can actually harbor bacteria that can get on your skin and cause acne. So it's best to just use your hands. And there's one more thing I want to touch upon briefly, and that's the role that diet plays in the formation of acne. Patients ask me all the time, should I change my diet? Should I eliminate food? Honestly, there's a lot more research being conducted in this area and a lot we don't know yet. But what we have seen is in patients who have a high sugar diet, also if you're someone who drinks a lot of skim milk, we see worse acne with those patients. And if you're someone who drinks whey protein, so particularly in men, I actually think of one patient in particular who I saw recently who had done a course of Accutane, and then he came back a few months later and he said, "Oh, my acne came back and I don't know why. What's going on?" And we said, "Well, are you drinking protein shakes?" Because he was someone who likes to be at the gym and he had big muscles. And he said, "Yeah, I drink a lot of whey protein." So we knew that the whey protein was definitely flaring his acne. And even if he was taking Accutane and still continuing with those high whey protein shakes, he was still going to get bad acne because we know that there's a correlation there. So the diet and acne correlation is still, not completely clear, but we have seen clinical correlations with those foods. Now for the golden question, how do you treat acne? The most successful way to treat acne is being consistent and patient. Acne is not going to go away overnight and it will take time. Give it at least 2 to 3 months before you say that something isn't working. But be consistent with your routine and make sure that in order that you comply with your routine, that it works with your schedule. So I always recommend using your products in the morning and evening when you're brushing your teeth, either when you get up from bed or when you're going to sleep at night. That way it's part of your routine and you know you have to do it. If you're someone who deals with blackheads, whiteheads, or comedones, the treatment option I recommend for you is going to be a retinoid. And you could start with an over-the-counter retinoid. One very common one is called adapalene, also known as Differin Gel. I highly recommend this to all my patients. And I want you to give this at least 2 to 3 months to see any change in your skin. Also, if you're new to the retinoid game, then I recommend only using a pea-sized amount on your entire face. Always follow it with moisturizer once it dries. And you may not want to use it every night to begin with. I always say start slow and build up until your skin can tolerate it, because I don't want your skin to get irritated and dried out. And then you're just going to say, this doesn't work for me, I'm giving up. And you're going to throw it out and say, I need another option. It's going to work for you, but you have to be patient. And now it's possible that the adapalene or Differin Gel is just not strong enough for your skin and for your acne. And it's possible you'll need a prescription strength. And one very common one is called tretinoin. And I recommend the same way to use it, just a pea-sized amount for the entire face. And I'm going to go into more detail in another video about how to use it properly to avoid irritation. But this is definitely my go-to if you're someone who struggles with whiteheads, blackheads, and comedones. Now, if you're someone who struggles with papules or pustules and has a little more than just those whiteheads and blackheads, I recommend adding an additional step into your acne routine, and that's using a benzoyl peroxide wash in the morning. And the reason I say to add this into your routine is because it's antibacterial. So it's going to fight against those P. acnes that are causing bacteria, and The way I recommend using it is you put about a coin size amount onto your palm and you gently moisturize it and lather it into your skin. Leave it on for about 2 minutes before you rinse it off, and rinse it off completely. By the way, benzoyl peroxide can stain your towels, sheets, linen, so make sure you're not going to go right to bed or wipe your face off with a white towel so you're not staining any nice, beautiful black or blue towels. Also, I recommend if you have sensitive skin to start with the benzoyl peroxide wash. Either this Panoxyl makes a great one, or CeraVe makes another one that I really like. And start with the 4% if you have sensitive skin. If you have skin that may be able to tolerate a higher percentage, then you can start with the 10%. But I always recommend starting low and slow and then building up from there, because the higher percentage you go, the more irritating and drying it can be to your skin. And then at night, you'll follow that with the retinoid, because the retinoid is anti-inflammatory and it's going to increase the cell turnover. If the topical treatments are not working for you, then we have other options, and these are usually the oral antibiotics like doxycycline. Also, we have something many of you know and have heard about called Accutane, also known as isotretinoin, that can treat moderate to severe acne, and it's great for cystic acne and even acne scars. Or it actually helps stop oil production. So if you're someone with very oily skin, I actually have a patient who didn't have that much acne on their skin, but had such oily skin, it looked like they were like sweating profusely. And he just wanted to go on Accutane just for that purpose alone. And that's totally okay. And it's safe and normal. However, you cannot use Accutane in pregnancy. And I also don't recommend using retinoids in pregnancy. There are other options if you're pregnant, or alternatives to benzoyl peroxide and retinoids, including salicylic acid and azelaic acid. And I can talk about more pregnancy safe acne treatments in another video. I also want to suggest that if you have acne scars, you may need to treat them with laser treatments in order to smoothen out the surface and help get rid of those acne scars. There's one more thing I must add. Please do not pick, pop, or squeeze your pimples. This can lead to scars that are potentially permanent. Remember, treating your acne successfully is all about consistency. So find a routine that works for you and stick with it. I assure you, your acne will get better. If you have any questions, leave them in the comments below, and I can't wait to see you in the next video.